The data are preliminary so far, but there are concerns that some of the new COVID strains are more infectious, more deadly, and possibly even more resistant to the vaccines. Given that, experts stress mass vaccination is crucial to slowing this spread because studies show that vaccines can prevent severe disease, hospitalization, and death. William Brangham has our conversation about what can be done in changing public attitudes.
Judy, Dr. Atul Gawande leads one of those mass vaccination campaigns in Massachusetts with his company CIC Health. He is a surgeon at Brigham and Women's Hospital in Boston. Dr. Gawande is also a staff writer at the New Yorker magazine, and for its latest issue, he visited one North Dakota town when it was suffering a terrible COVID outbreak and also a very open fight over the public health protections meant to contain it. And he joins me now. Dr. Gawande, great to have you back on the NewsHour. First, about these vaccination program you're running. Your company, in a sense, was created to step into the breach, initially over testing, now over vaccinations. When we look around nationally, some states have done well, many have really struggled with this. Do you have a good sense as to why this initial stage has faltered so much?
First of all, everybody was late to planning. This should have been part of the planning process months ago. States were coming forward asking for that planning process, but it really didn't get underway until after Thanksgiving. We got involved to enable mass vaccination at Gillette Stadium, Fenway Park, Reggie Lewis Track and Field here in Boston. And the challenges really were that the planning only got underway maybe the week before Christmas for enabling this kind of mass scale that we're now hitting. So the good news is people have had 6 weeks, 8 weeks of getting these operations up and running. We're now past 2 million vaccinations a day that hit the peak over the weekend. And we are well on our way to reaching 100 million vaccines in arms by 100 days. But we have to move even faster because of the mutant strains that are spreading that you mentioned.
Yeah, how concerned are you about those? Because there is a concern both about they might be more contagious. One of them might be perhaps more deadly. It seems like we really are in this race against time to get the shots before the variants truly spread.
Yeah, we have across the world tens of millions of active infections and a very large base of infections here that become a petri dish for lots of new mutations. And some of those mutations that are emerging and spreading, one from the UK, one from South Africa, one from Brazil, these are more contagious and in some cases have some less effectiveness with the vaccines. I'm very concerned about these. The doubling time, the rate at which you see this virus spreading to double its number is only 10 days. Florida already is at 5% of all infections there have the UK variant, which we know to be more contagious. That means that as our counts drop right now for the wild type that had been the dominant one in the US, we're seeing a rise in this more contagious version, which means around March, we can expect real trouble unless we really double down, not just on vaccines, but on our masks.
I'd love to turn now to your piece in the New Yorker, which you focused it in Minot, North Dakota, when that region was going through its worst stretch of the pandemic, and they were having this very public, open fight about a mask mandate in town. Can you just give us a synopsis? What was the debate about? That masks don't work, that the virus isn't such a threat? What was the debate going on there?
It was a fierce debate over both, an argument over whether masks work, and then also about whether this was a really serious infection worth attacking or not. And then at a more fundamental level, and I really engaged in discussion with people across the spectrum of opinion, people were riven about the fact that there was pain and suffering among not just about the public health consequences, which us experts have tended to focus on, but also, they felt their arguments weren't being heard about their jobs being damaged, about not being able to have their kids in schools, and they just wanted to return to normal. That fierce debate was had out in a city council that forced the issue. The state would not adopt the mask mandate, but the city council did. And over time, what you saw throughout North Dakota, which at that time had the highest rates of infections, you saw a place change where mask wearing reached a high of 89% in the state. Now, the challenge is, can they keep the foot on the pedal? The mask mandate was repealed just a couple of weeks ago.
I mean, I hear everything you're saying about the importance of recognizing the economic pain caused by some of the shutdowns and restrictions. But I mean, this pandemic, as you well know, is not over by any stretch. People are going to still have to wear masks and not crowd into bars and all of those public health measures. Going forward, from what you've reported, what is your sense about how we ought to do our messaging about public health better next time, this time?
Well, I think the first thing to understand is we're not going to get consensus on these issues. The question is, can we have an open, respectful debate, hear each other, pay attention to the pain everybody's feeling? You have people who are reluctant to enter back into society as rates fall and participate, and you have reluctance on the other side about taking the measures that we need to stop the infection from coming. There is a lot of exhaustion. There's a lot of pain, and we are going to be, the debate, the arguments, the anger isn't going to stop. And yet the country, even North Dakota, got past 80% wearing of masks. They got the infections down. The debates will be hard and fierce and angry, but our democracy may be frayed. What I saw there, though, was it wasn't broken, that we were able to hold together, have these fights, and then move forward.
Dr. Atul Gawande at Brigham and Women's Hospital and The New Yorker, thank you very much.
Thank you.